So today's topic is myasthenia gravis, which is an autoimmune disease of the neuromuscular junction characterized by muscle weakness that worsens with activities and improves by rest. The etiology is antibodies directly against the postsynaptic acetylcholine receptors. Most common associated condition is thymoma and thymic hyperplasia. Clinical features include extraocular muscle weakness, fatigue, skeletal muscle weakness, proximal muscle weakness, bulbar muscle weakness such as difficulty chewing, difficulty swallowing, and dysarthria. With the extraocular muscle weakness, you're thinking about diplopia, drooping of the eyelids, all that. Pathophysiology is antibodies binding to the postsynaptics. The antibodies are in green and the postsynaptics are in purple, which I circled over there. So these antibodies are preventing acetylcholines from binding to these postsynaptic receptors, which will cause decreased muscle cell activities, which will reduce the muscle contraction, leading to all these diplopias. Most of these diseases are seen in women a lot. The diagnosis, in this case, they're using the hydrophonium test, which is also known as the short-acting acetylcholinesterase inhibitor, which will prevent the breakdown of acetylcholine over here, which will cause an accumulation of the acetylcholine in the synaptics, so that it will be able to bind to the postsynaptic instead of the antibodies, which will end up causing the activities of the cells to increase. So then you see an improvement of these muscle weaknesses. Differential diagnosis is lumbar eating syndrome, which is also a neuromuscular disease or neuromuscular junction disease characterized by proximal muscle weakness and autonomic dysfunction. The pathophysiology is antibodies against presynaptic voltage-gated calcium channels. In lumbar eating, the patient gets better once they use their muscles, unlike myasthenia gravis when it gets worse while they use the muscles. Treatment in myasthenia gravis is cholinesterase inhibitors and steroids as well. And then the most common complication is respiratory failure. Thank you.